the neck, the part of the body extending from this part, the clavicle, also known as root of the neck, up to the base of the skull is the neck. So this part is the neck. It is having anterolateral part and the posterior part. For descriptive purpose, the neck is divided in the two areas or two triangles. One is the triangle which is lying anterior to the sternocleidomastoid, and other is the posterior to the sternocleidomastoid. So here, this is the side of the head and neck. The beautiful eyes. So this is the side view of the head and the neck part. And this is the other view, chin, the neck, the sternum, manubrium of sternum, and this is the ear. In this diagram, the ear is here. This is the mastoid process, and this is the superior nuchal line extending from the mastoid process up to the external occipital protuberance. And this is the hyoid bone. The mandible is here. So this muscle on the posterior part, this muscle is trapezius muscle. This trapezius muscle is running from the superior nuchal line up to the clavicle, the outer part of clavicle, the acromion process and the scapula. Anterior to this is the other muscle, and that is the sternocleidomastoid. And this is the third muscle of the region. It is having a fibrous pulley here. So this is the anterolateral part of the neck, the side of the neck, and in this diagram we can see four muscles. One is the trapezius, the sternocleidomastoid running from the medial part of the clavicle and the manubrium part of the sternum, so known as sternocleido, running up to the mastoid process. The third muscle from the mastoid process up to the hyoid bone and through a fibrous pulley, the anterior belly of the muscle is inserted on or taking origin from the digastric fossa of the inner part of symphysis mantae. So this is the anterior belly, this is the posterior belly of digastric, and this is the sternocleidomastoid. So this is the clavicle and part of the manubrium sterni, the suprasternal notch, or also known as the jugular notch. So sternocleidomastoid is running from this part of the sternum, running upward and backward. This is the sternocleidomastoid. If you can see this muscle running upward and backward and inserted on the mastoid process and part of superior nuchal line of the occipital bone. There is formation of two triangles. One triangle is behind and other is in front of the sternocleidomastoid. So this triangle this is the anterior triangle. So the boundaries of the anterior triangle are formed by base of the mandible and its projection from the angle of the mandible running backwards. So this is the angle and this is the projection of this, and running up to the mastoid process of the temporal bone. So this is the base of the mandible running backwards from the angle of the mandible up to the mastoid process, an imaginary line joining the base, the end part of base, that is the angle of the mandible and the mastoid process. So this is the upper limit of the or base of the anterior triangle. So this lecture is on the anterior triangle. So here we will see only anterior triangles of the neck. In this diagram, the sternocleidomastoid is running here. This is the anterior median plane. So the area which is bounded by the mastoid process, a line joining the mastoid process to the angle of the mandible and base of the mandible, this is the base of the triangle. In this diagram, this is the base of the triangle. The anterior border is formed by anterior median plane of the neck, which is extending from symphysis mantae up to the mid part of the hyoid bone. This is the hyoid bone, descending downwards and joining the middle part of the jugular notch or suprasternal notch of this manubrium part of the sternum. Posteriorly, it is bounded by anterior border of the sternocleidomastoid. So triangle is having its apex. So this is the apex of the triangle, which is directed downwards. This is the apex and this is the base. This is the base. This is anterior border and this is the posterior border of the anterior triangle of neck. In this diagram, the posterior border is formed by anterior border of the sternocleidomastoid muscle. The base is formed by base of the mandible and imaginary line running from the angle of the mandible up to the mastoid process and mastoid process itself. The anterior boundary is formed by the anterior median plane of the neck. So this is the anterior triangle. Here I will draw. The anterior triangle is roofed by skin, superficial fascia, the platysma, deep fascia, and it is also having cervical branch of the facial nerve and the ascending and descending branches of the anterior cervical cutaneous nerve or transverse cervical cutaneous nerve. So roofed by the skin, superficial fascia, platysma. Beneath the platysma there is the cervical branch of the facial nerve which innervates the platysma muscle. Platysma muscle is here and it is also known as shaver's muscle, used during shaving to tight the skin of the neck. And the deep fascia, which is known as investing layer of the deep fascia, although it is having modifications like pretracheal fascia, prevertebral and carotid sheath. This triangle is again divided in 4 triangles, or more better, it is divided in 3.5 triangles. 3.5 triangles. So 3.5 triangles on right, 3.5 triangles on left. There are total 7 triangles in both anterior triangles of the neck. 3.5 in this side, 3.5 in this side. So half triangle is formed by this small triangle. This half triangle is known as submental triangle. So because it is beneath the symphysis menti, so known as submental triangle. It is half on right and half on left, forming one triangle. So submental triangle is bounded on both sides by the anterior bellies of the digastric on right side and left side. Base of this triangle is formed by hyoid bone. This is the mandible. This is the hyoid bone. This is the median raphe. And this is the hyoglossus. So fibrous pulley is here. This is the anterior belly, forming a sharp turn on the fibrous pulley formed by the investing layer of fascia, and this is the posterior belly of digastric. In other side also, triangle is formed between two anterior bellies of the digastric. Base is formed by hyoid bone. Apex is directed forward and behind the symphysis manti. So this small triangle is formed by the two anterior bellies of digastric, and this triangle is submental triangle. This is subdivision of the anterior triangle of the neck. This triangle between the base of the mandible, an imaginary line extending from the angle of the mandible up to the mastoid process. This is the base between the anterior belly and the posterior belly of digastric. The triangle is named as digastric triangle. This is digastric. Digastric triangle. Antero-inferiorly by anterior belly of digastric, posterior-inferiorly by posterior belly of digastric, and base is formed by the base of the mandible and a line extending from the angle of the mandible up to the mastoid process. So this is a digastric triangle. I will explain the contents and relations of the all triangles one by one. So submental and the digastric. Now we can see one more triangle here. This triangle is bounded antero-superiorly. This is anterior, this is posterior. Antero-superiorly by the posterior belly of the digastric. Bounded antero-superiorly by posterior belly of digastric, antero-inferiorly by a muscle which is running from the shoulder up to the hyoid bone. The word omo is used for shoulder. So name of muscle is omohyoid. Omohyoid is running from shoulder up to the hyoid bone. But the part of omohyoid muscle above the sternocleidomastoid is the superior belly, and below the sternocleidomastoid is inferior belly. So this superior belly of the omohyoid, anterior and posterior bellies of digastric are dividing this anterior triangle. So antero-superiorly bounded by the posterior belly of digastric, antero-inferiorly bounded by the superior belly of omohyoid. So this is omohyoid. And posteriorly it is bounded by anterior surface or anterior border of upper part of the sternocleidomastoid. This triangle is mainly having vessels, nerves, and especially it is having the carotid system of arteries. So named as the Carotid Triangle. This is the Carotid Triangle. Now one more triangle is remaining here. Up to now we have seen 2.5 triangles. This triangle, which is anterior to lower part of the sternocleidomastoid, so bounded posterior-superiorly by superior belly of the omohyoid, posterior-inferiorly by the anterior border of lower part of sternocleidomastoid, and anteriorly it is bounded by anterior median plane. And this part or this triangle is especially having strap muscles, the infrahyoid muscles. So name of the triangle is muscular triangle. So this triangle is named as the muscular triangle. In this diagram we can also see the posterior anterior belly of, this is the hyoid and this is the omohyoid. So this is also having digastric triangle between the base of the mandible, posterior belly and anterior belly of digastric. This is the digastric triangle. Submental triangle is here. Submental of the right and left are forming the one triangle. The carotid triangle is seen here, and this is the muscular triangle. So all together three and a half triangles can be seen on right anterior triangle of the neck. 3.5 triangles can be seen on a left anterior triangle of the neck. Total 7 triangles can be seen, because half right and half left submental triangles are forming a single triangle. After a short break, we will see the contents of these triangles, especially clinically and more complicated, the carotid triangle. So after a short break, I will talk about the muscular triangle, carotid triangle, digastric triangle and submental triangles.